Operations aren't for everyone. So some people just don't want to have an operation, or maybe they don't fit the criteria for an operation. So definitely that's when we start talking about medication. And we've got some really good medication now that can help you lose weight. Duramine's been around for 60 years. It is an amphetamine derivative. It'll give you a lot of energy and bounce during the day. Some people have trouble sleeping with it, but definitely it'll help contain your appetite, and people tend to eat less, and as a result they lose weight. Saxenda's been around for the last few years. It's an injectable. You give yourself an injection with a little pen into you need to find a bit of loose skin to put it into, and all of us have got some of that. And it just suppresses your appetite as well. It's a little expensive. It's about $380 a month on maximum dose, but definitely it's got very little side effects, and we like to prescribe it. Contrave is the new medication. It's been on the market for about 3 months now. It's actually a combination of two old drugs that have been around for a very long time. So we feel from a safety point of view, it's actually quite a good medication to be on. The bupropion, which is one half of it, is an old antidepressant. So it helps with depression a little bit. The naltrexone is what we've been using to combat addiction. And what the naltrexone does is it suppresses the cravings that you get. So definitely when you're on a diet and you're starving, the naltrexone helps you with that component. And we find that the medication with a VLCD diet works really well to kickstart the process, and we can play around with the medication. The average weight loss with medication, it's about 10 or 15 kilos over about a 6-month period. But the nice thing about medication is you can try it, and if it's working, fantastic. If you're finding you're not losing the weight that you want, or you're finding that there is a side effect that you're not enjoying, you can stop it. You know, you can take a break for a month or two and then see how you go, and we can always restart it. So there's a lot of flexibility with it. Definitely we find there's a role in people that have had surgery and they want to lose a little bit more weight. The medication works really well, or if they're weight regaining, we can use it at that situation as well. So, but you should talk to us, obviously, before we prescribe something, and we'll find the right medication that works for you.